Okay, cool. So what we're going to do now is we're going to talk about the arterial tract and how blood travels through the lower extremity. Um, so let's get to it. All right, so I am going to start with, I'm going to start real up high. I know for class he wants us to just kind of know where it starts at within the pelvis, so your external iliac. But we're going to start here at the heart, right? I'm sorry, I have a terrible heart. But that's going to travel inferiorly and it's going to travel through the descending aorta. Okay. From there, it's going to go down and it's going to bifurcate, split into two. And then this is where you have your common iliac. That common iliac is what turns into what we know as, so I'm going to bring this over here, your internal iliac and your external iliac. Alright, and then we're just going to continue the external iliac. We'll worry about the internal iliac a little later. Just know that's what kind of innervates most of like what's inside the pelvis and a little bit of it behind. So external iliac, what does that turn into? So the external iliac is going to travel and it's going to pass below the inguinal ligament, right? It's going to pass below the inguinal ligament and go into what's known as the femoral triangle. So once it passes this ligament, it becomes a femoral triangle, okay? And I'm just going to draw it like this. This is how I like to draw it, right? This can be your femoral triangle. Right? So once it passes this inguinal ligament, right, it's going to turn into the femoral artery that we know so well. Okay? It's going to pass through the femoral triangle, and that's where you have your femoral nerve, that's where you have your femoral artery, and your femoral vein. So once it passes through here, so the reason I like to draw this triangle like this, because this apex kind of transitions into what we know as the adductor canal. Okay, and I just draw like a longer triangle, just so visually I can see it, I can map it out. Um, so the femoral artery is going to still travel through the adductor canal, but this is where it starts to split off a little bit. Okay, so it's going to split off. It's going to do a couple things. Okay, it's going to turn into a deep femoral artery. And this deep femoral artery is going to have four perforating branches, right? And this is what's going to give blood supply to a lot of the leg. Um, it kind of goes into some of the bone, it goes into some of the posterior and anterior thigh. That's where you get the blood supply. But if I draw out let's see if I can draw this right. Right, there we go. That's not too bad. Right, so this is the femur, okay? That deep femoral artery, so you have your femoral artery just kind of travels like that. You're going to have your deep femoral that travels here. You have your four perforating branches. And then you're going to have what's called the lateral and medial circumflex arteries, right? So I'm perforating here. Perforating artery. And you're going to have your lateral and medial circumflex arteries. So lateral femoral, really femoral is in the name. So lateral femoral circumflex and lateral medial circumflex, or medial femoral circumflex. So that kind of provides blood supply to this proximal position or area of the femur. So another thing to know about this area is that here on the, we're going to call this the lateral one, right? And it's going to be your medial. Move that over a little bit. Oh no, I deleted it. Okay, there we go. That's a little better. All right, and that's going to be your lateral. This lateral circumflex is going to have a branch. It's going to run down, and I'm actually going to do that in a different color. Ooh, where'd it go? Where did we go? Ah, here we go. We're back. Okay. Delete that. I'm going to do this in a different color. So that is going to become our, oh, let's do it different. I don't like it. It looks too much like that one. We'll do green. So this right here is going to be your lateral descending circumflex, lateral femoral descending circumflex, right? So off of that lateral one, we have your lateral femoral circumflex descending branch. And I put this in a different color because it's going to come back to meet up with our femoral artery or our popliteal artery, and it's going to help with creating the genicular anastomosis of the knee, right? So we'll come back here. So here, we're back here, right, at our femoral artery. So I'm just going to bring this down like this a little bit, all right? So once it passes the adductor canal and it starts to go into the, well, it passes the, delete that a little bit. It's going to pass through the adductor hiatus, right? So once it passes this adductor hiatus, this femoral artery will become what's called the popliteal artery. It's important to know that this is a pretty small, it's short compared to, the length of it is short compared to most of the other arteries, right? And it's just because it's within the popliteal area or popliteal fossa, and it starts to become other things once it passes it. So let's look at the popliteal fossa, right? So it's kind of shaped like that, like a diamond. I'll delete some of this, right? And so once it gets here, you're going to get a couple things, right? I mentioned the genicular, actually I'm going to write this over here a little bit. I want to make its own table, right? So we have the we're going to make it a different color, just so it can pop out a little more. So we're going to have our genicular anastomosis. I don't know if this is how you spell it. That's how I think you spell it, but just know it's called an anastomosis, right? So this genicular anastomosis is made of a couple things, all right? It's going to have that descending branch from the lateral femoral circumflex, right? It's going to have the genicular branches, or yeah, we'll just call them branches, or the genicular arteries that come off of the popliteal. So I don't like that. There we go. So genicular arteries, you're going to have, so I'll get into this a little bit later, but you'll have your genicular descending. I'll explain how that's different. And then you have your anterior, or let me see this. There we go. Recurrent anterior tibial artery, right? So that's what you get there. Genicular anastomosis is made from the descending branch from the femoral lateral circumflex. I'm not writing at all. I don't feel like writing at all. You have your genicular arteries, and you have your genicular descending, and then your recurrent artery, anterior tibial artery. All right, so let's come back here, see how all that works, right? So here in this popliteal fossa, you're going to have 1, 2, 3, 4, 5, right? So this is going to be your, we're going to call this side the lateral side and this side the medial side, okay? So you're going to have your lateral superior or superior lateral, right? I prefer superior, yeah, that's first. Superior lateral genicular artery, right? This is going to be your superior medial genicular artery, okay? And then this is inferior lateral genicular, and this is going to be your inferior medial genicular. And then this little middle branch, right, that kind of innervates some of the inside of the knee, or innervate. It's going to add blood supply to some of the middle of the knee, so like inside the joint. This is going to be your middle genicular artery. Okay. So I mentioned that descending branch, right? So all this kind of happens around the knee, so around the condyles of the femur and the tibia. You have a descending branch that comes from up here, and it's going to add to it at the anterior part of it, right? So this one right here is your descending genicular. Okay, there we go. Yep. So that's your descending genicular, right? So then I said before, right, you have your recurrent anterior tibial. So we're going to pass this popliteal fossa, right? Once it crosses kind of the condyles of the tibia, you're going to see them split, all right? So then you're going to have your, we're going to make these, yep, we're going to make these two different ones, a little longer, because they have a bunch of stuff that come off it. Okay. So we're going to do the anterior, right? So anterior tibial, and then your posterior tibial. Right? So your posterior tibial, your perineal or your fibular artery, whatever you want to call it. If you Google this online, a lot of them will use perineal fibular interchangeably, right? So these run on the posterior side, so posteriorly to the interosseous membrane. Now, the anterior tibula, anterior tibular, the anterior tibial artery, oh, here we go, anterior tibial artery, right? That's going to pass through and go anteriorly through the interosseous membrane, right? Like I said, we're going to do the triangle osseous membrane, right? And once it passes that interosseous membrane, it's going to have a branch that runs up and goes to the genicular anastomosis up here. And that's going to be your recurrent, so we'll do this in a different color. Actually, I'll just delete it. That's faster. This is going to be your genicular, or, sorry, your recurrent anterior tibial artery. Okay, so this is the guy that runs up and goes into your genicular anastomosis. Okay, so you have your anterior tibial that comes from the popliteal, you have your anterior tibial, your posterior tibial, and your perineal. Right? So we'll start with the anterior tibial. The anterior tibial is going to run down the foot, so it's going to run down the tibia, and then once it crosses that imaginary line that makes up the imaginary line that separates the ankle or the foot from the lower leg, it's going to travel on the dorsal aspect of the foot, and it's going to become the dorsalis pedis. Ooh, I don't know what happened there. Artery. Okay. So then the dorsalis pedis artery is going to split, and I'm just going to draw this little circle thing. Okay. So it's going to go down. It's going to kind of follow along the first metatarsal. And then it's going to stay the dorsalis pedis for this length right here, right? For that length, it's going to stay the dorsalis pedis. And then it's going to have a branch that kind of runs along the metatarsals. And that is going to be your arcuate artery. And then it also has a branch that's begins a little more proximally up the foot, or the dorsal aspect of the foot, and it's going to have one that kind of runs this way, right? This is going to be your lateral talus artery, okay? And this whole thing, this little circle I made, perimeter, whatever you want to call it, that's going to be the anastomosis of the dorsal side of the foot, right? So this dorsalis pedis, like I was saying before, kind of runs along that first metatarsal, just around there, kind of that pathway. And then it's going to go in between the big toe and the second digit. So big toe, oh, that's terrible. Second toe, so it's going to be your first digit and your second digit, right? It's going to pass in between there, and it's going to go to the plantar surface, right? And this is going to be your, I want to say your deep, let me make sure I got that right. Sorry about this little mayhap. Oh, here we go. That is going to, yep, I was right. That's going to become your deep plantar artery. Now it's going to run along the the plantar surface of the foot. Okay, so we'll come back. We're going to leave it there. We're going to come back to this posterior tibial and the fibula. So I'll just start with the perineal artery or the fibular artery. So this artery is basically going to just terminate, right? Going to terminate just kind of at the lower leg. And it doesn't really change into anything else, right? But this posterior tibial artery is going to do a few things, okay? It's going to change into your, do this like that, yep, okay. It's going to change into your lateral and your medial plantar arteries. Okay. And it's going to change into this, and that's once it passes the medial malleolus. The triangle there, there we go. And that's an important landmark because that's where we'll have the, that's where you'll be able to feel the post kind of behind the medial malleolus, right? Okay, so we have that, right? So the medial one obviously is just going to stay with kind of immediately in the foot. It's going to run along the toes of the foot, and then your lateral one is going to go more laterally. But a big thing about here is your lateral and your medial are going to meet again. So if I had, this is going to be a terrible foot, okay? And I'm not drawing the whole foot, right? That's your big toe right here. Okay, so you're going to have your medial one kind of run this way. You're going to have your lateral one. It's going to split from that posterior tibial. It's going to run this way, right? So both of them are going to meet once this artery is created, right? And that artery is called what was it called? Oh, I had a brain fart. That is going to be called your deep, there we go, deep plantar arch. And that's what's going to make that anastomosis on the bottom of the knee. And so if you remember before, I said the deep plantar artery is from the on the dorsal side is going to come to the plantar surface. And so you'll have that deep one kind of come in and innervate, or not innervate, connect here with the rest of the arteries on the plantar foot. But those are the big arteries that are in the plantar foot. But yeah, that is that for the lower leg and the branches that come off of it. So I'll just run through this again. So once again, you have your heart that is right here, right? Let me get a different color. I want yellow. Yep, I'm going to get yellow. Here we go. Okay. Here we go. That way you can see where I'm pointing. So you have your that's your heart, right? You have your descending aorta, your common iliac, and then you're going to go into your external and your internal iliac, right? That external iliac is going to travel below the inguinal ligament, and it's going to turn into the femoral artery. That femoral artery is going to go through the femoral triangle, and then it's going to become, so if you continue down, it's going to go through the adductor canal, still remain the femoral artery, but before the adductor canal, you're going to have your deep femoral artery, and that's going to split into your perforating arteries, your lateral and medial circumflex arteries, and then from that lateral circumflex artery, you're going to have the lateral femoral circumflex, the descending branch. And that's important because that's going to come here and go to the genicular anastomosis, right? So back here, back to the femoral artery. Once it passes that adductor hiatus is going to become the popliteal artery, right? In that popliteal area, the popliteal fossa, the genicular anastomosis is going to be created. So you'll have your superior lateral, your superior medial, your inferior medial, and your inferior lateral, and that little middle one that's all the genicular arteries. And it's important to remember you do have your descending genicular, and then your recurrent artery, recurrent anterior tibial artery that comes from the anterior tibial artery. That's going to come back and join here within that anastomosis. I don't think I mentioned it, but I'm just going to, let's see where I can draw it. We'll draw it right here. So this is, let's say this is your patella, right? And then you have your joint, right? Ooh, let's put that patella a little more deep in the middle, right? So you have your patella kind of like that, right? So those circumflex arteries, or those genicular arteries, they're going to come this way and do this thing, right? Then you're going to have your descending that's going to come this way. And then you're going to have your tibial that comes this way. And then that descending is going to come in this way, right? And that middle one is in the back, right? And it's going to kind of bring all this together. But all of these will connect and kind of make this circle that you'll see. If you look in visible body, you can see that, and that'll create the anastomosis of the knee. Okay, but that's that. Once it passes those condyles of the tibia, just that general area, you're going to have your anterior tibial and your posterior tibial. The anterior tibial is going to pass through the interosseous membrane. It's going to run down, and it's going to help supply blood to the anterior compartment of the leg. It's going to become the dorsalis pedis artery. That dorsalis pedis artery is going to create an anastomosis on the dorsal aspect of the foot. You're going to have your lateral talar or lateral talus artery, and then you're going to have your arcuate artery that kind of runs along the metatarsals. And that's going to create your anastomosis. That dorsalis pedis is going to travel, right? It's going to be this little length of it. And it's going to travel between the first and second digit and travel posterior, or not posterior, it's going to travel to the plantar surface of the foot and become the deep plantar artery. And that's important because it's going to connect here to your anastomosis of the plantar foot. But that posterior tibial artery. From that, you'll have a branch that becomes a perineal fibular artery, and it just kind of ends there, supplying blood to the muscles in that area. It doesn't really do anything in the foot, it doesn't go anywhere, it just kind of ends there. But that posterior tibial can travel behind that medial malleolus and wrap under the foot, where you'll get your lateral and your medial plantar. So that lateral and medial plantar, like I said, this one right here is going to be your medial. This green one right here is going to be your lateral. And then this arch that's created between the two is your deep plantar arch, right? And then this little pink thing right here, that is your, like I said, that is your deep plantar artery. And that's the anastomosis of the plantar foot. But yeah, that is the external iliac and where it goes. Let's kind of pop back here to the internal iliac, okay? Because it does its own stuff. So there are a few arteries that come off of this, but I'm just going to focus on the ones that I've been taught so far and the ones I feel that should be important for you to know. So you're going to have three main ones, right? You're going to have your superior gluteal artery, your inferior gluteal artery, oop, that's terrible, and then your pudendal artery. So I wanted to bring these up because these two kind of go and provide blood supply to just the butt, you know. But these are going to pass through the greater sciatic foramen, right? Well, actually, all three of these kind of do that, right? I wanted to separate pudendal because the difference with the pudendal is it does go through the greater sciatic foramen, but what it does is, let me draw this for y'all. So let's draw the pelvis real quick. I'm gonna start with that's your vertebrae, right? That's your sacrum, and then you have your pelvis, right? Pelvis, okay? And then you're gonna get your sacrotuberous ligaments, and you're gonna kind of do this. This drawing might be off. I'm not sure if I'm drawing these right, honestly. They kind of do that, right? And they create between the ilium, the sacrum. You'll get your greater kind of right there, and your inferior right there, right? So they pass kind of through here. Your pudendal is going to pass through the greater sciatic and just loop right back in. And it's just going to go through the lesser sciatic foramen. So this one will also have the lesser sciatic foramen in there, right? So I'll just repeat that again. Your superior gluteal artery and your inferior gluteal artery are going to go through their sciatic foramen. Your pudendal is going to go through the sciatic foramen as well, right? But then it's just going to loop back and go through this lesser sciatic foramen, right? And it's just going to innervate everything that's in the pudendal area. But that is what I got for arterial tracts and how it flows.